Why is my letrozole cycle not working? If you have been using letrozole to try to stimulate ovulation and it doesn't seem to be working, you're not alone. Many women wonder why their treatment isn't producing the expected results. Letrozole is often prescribed for women with polycystic ovary syndrome or unexplained infertility because it can help induce ovulation. It works by lowering estrogen levels, which signals the brain to produce more follicle-stimulating hormone, encouraging the ovaries to develop follicles and releases eggs. However, despite its effectiveness, some women may find their cycles are not responding as hoped. One common reason is that infertility can have multiple causes. While letrozole is very effective for women with polycystic ovary syndrome, it may not be enough if other issues are involved. For example, severe endometriosis can interfere with fertility by causing inflammation, altering pelvic anatomy, and impairing egg quality. Tubal disease or diminished ovarian reserve can also reduce the chances of successful ovulation and pregnancy, even with medication. If these underlying problems are present, letrozole alone might not be sufficient to achieve ovulation or conception. The dose and timing of letrozole are also crucial. Typically, letrozole is taken 4 or 5 days early in the menstrual cycle, but if the dose is too low or the timing is off, ovulation may not occur. Some clinics adjust the dose based on individual response, sometimes combining it with follicle-stimulating hormone injections to improve outcomes. If the dose is too low or not tailored to your specific needs, your ovaries might not respond adequately. Individual differences in ovarian sensitivity can also play a role. Some women simply do not respond well to letrozole due to factors like age, ovarian reserve, or hormonal imbalances. This resistance is less common than with other medications like clomiphene citrate but can still happen. If your ovaries are less responsive, your doctor might consider alternative treatments or additional medications. Another factor to consider is the health of your uterine lining and cervical mucus. Even if you ovulate, a thin endometrial lining or unfavorable cervical mucus can hinder sperm from reaching the egg or prevent implantation. Letrozole generally has a positive effect on the uterine lining compared to other drugs, but in some cases, additional measures might be needed to optimize the environment for conception. Monitoring is key. Proper ultrasound tracking of follicle growth and hormone levels helps determine the best timing for intercourse or intrauterine insemination. If monitoring is inconsistent or timing is off, even if ovulation occurs, conception might not happen. Accurate timing ensures that sperm and egg meet at the right moment. Lifestyle and overall health also influence treatment success. Obesity, thyroid problems, high prolactin levels, and other systemic health issues can impair ovulation and implantation. Stress, smoking, and poor nutrition may also reduce your chances of success. Addressing these factors with your healthcare provider can improve your response to treatment. If letrozole alone isn't working, your doctor might suggest other options. These could include gonadotropin injections, which directly stimulate the ovaries, or addressing specific issues like endometriosis through surgery or medication. Sometimes, combining treatments provides better results. In cases where endometriosis is present, managing the condition is especially important. Endometriosis can affect ovarian function and the pelvic environment, making ovulation induction more challenging. A comprehensive approach that includes medical or surgical treatment of endometriosis can help improve fertility outcomes alongside ovulation induction. Remember, each woman's fertility journey is unique. If your letrozole cycle isn't producing results, it is essential to work closely with your fertility specialist. They can perform further testing, adjust your medication, or explore other underlying factors affecting your fertility. Letrozole is generally safe and effective, but success depends on individual circumstances and careful medical management. Always seek personalized advice from your healthcare provider to find the best path forward.